Hello, I'm Andy Mee from Havi, and again, I'm going to talk to you about a bit of information. Hopefully, can help you with your hand-arm vibration training. So the information that you give to the operators. That's the key of today's talk, really. So I've got this presenter. What this presenter is, it's my prompter basically, because when you do a bit of training, you always need a prompter so you don't forget what you're saying for obvious reasons. So this is our Toolbox Talk presenter. So it's going to help me tell you what you need to say. So go on to the first bit, and it's just almost set the scene, which is there's a law which says we should be complying with hand-arm vibration. What this helps you do is actually get the operators on side straight away, and you basically say to them, look, there is a regulation, there is a law that we've got. This is a reason, it's been put in place. It's hand-arm vibration. There's a law which sets the limits, what you're allowed to be exposed to, things like that. But we've got to comply with it, and it's important you set that out from the beginning. I find it works really well. Next bit is we actually go into the about you bit now. So we're going into who is exposed to it, how many people are exposed to it. And so here we've just got 5 million people exposed to damaging levels of vibration every year in the UK. What I like to do is take it a bit further than this, and obviously don't just read off this, but go into it a bit more. And the way we can do that is we can say, well, who here you would use a breaker? Who uses grinders, sanders, and make it specific to them. And if you do make it specific to them, then they actually understand it more and they're actually getting more out of it. And in a lot of cases, if you're doing the talk to people, you'll know the jobs that they do anyway, so you can actually bespoke it as it goes on. So it becomes a better toolbox talk in itself as well. So we move on to the next one. We're going to what is hand-arm vibration. Don't be too technical. The amount of presentations I've seen on HAVs where they've got wonderful graphs with sine waves on and what the magnitude is and what frequency means. You've got to ask yourself the question, does an operator need to know that in depth? They probably don't. There's also stuff with sums on how you work out average exposures and stuff like that. You don't need that. You just need to go in what is vibration. It pretty much is. It causes damage to your hands. It's a frequency that tools give off when you're clamped on with your hands, and it actually causes damage to your hands and your blood vessels and your nerves. It's important to go into that. That's what hand-arm vibration is. So it's a bit of a prompter on that. The next one, we've got how to comply with the regulations. One of the things I always say, and it's what I've always been taught as well, is your risk assessment. You assess what level of exposure, what level of exposure is compared to the law, the control of vibration at work rate. You've got the eliminate. Can we eliminate the vibration? Can we reduce it? And then where we can't do either of them, what we're doing to control it. Information and training, obviously this is part of what you should be doing, and then health surveillance tabbed on. So you're giving them an outline of how you're going to almost control hand-arm vibration for the company. Next bit, so we've got going to the risk assessment. How do we do a risk assessment? It's really easy to do, and it sort of almost gets them on board with the whole process as well. So if I explain to an operator that, well, what machinery are you using on a daily basis, and they might say a breaker. And what's the vibration magnitude of the breaker? You'd have that information, and how are you using the equipment for? That is it. That's a risk assessment. And with that data, we can then say, look, this is what your exposure is. And you want to make it specific to them as well. So if you've got, let's say, a road gang breaking out using breakers, we can actually say, look, this is your vibration exposure. And we say that during the presentation or during the toolbox talk. So it makes it really specific to them. It's really simple to do. You could do it using the HSE calculator. It's that easy. So this is almost like step one. How do we assess the risk? And you get to the point where operators will be able to assess the risk themselves. And they'll say, look, that task isn't even a risk. I hardly use the tool. It's really low vibration anyway. That's a great way to be. And if training can help achieve that, then it's brilliant, isn't it? So next one, we've got eliminate, reduce, control. So important to go through this, and the reason it is so important is operators generally, or end users generally, come up with the best ways to eliminate and reduce it anyway. So if we can explain to them, is there better ways of doing this, often you'll get a lot of fixes back. So it's important going through that. Also explain what your company's done. So if you have implemented things to reduce it, you've got a really good tool procurement policy, shout about it. Let people know internally what you're doing, because that way you end up sort of spreading the good news as such and saying, look, we are doing stuff to help you, we are doing good things. So just go on to the next one, we've got how to control. This is any system you put in place to control how often people are exposed to vibration or limit exposure, where we've done all you can to reduce it and eliminate it. But we've got the HAVI unit, so we can implement the HAVI unit. What I do like about this element is we've got the points, and I think the points are a brilliant way of managing exposure. So try and implement or train people on what the HSE points system is. Now, I'm not going to go into the HSE points system too much on this brief video, but it's really simple to understand. Go and visit the HSE website if you want to find out more and you're not sure what the points system is, but it's the easiest way of managing it. So the HAVI, we've got a bit of information on how you use the HAVI, but this is optional obviously if you are using the HAVI. And then we go into the symptoms. The reason we sort of leave this towards the end of the briefing is because we really want it to be the bit they remember, so what they've got to be looking out for. The reason this is in there is that the control of vibration at work regs states you should let people know what the symptoms are. Now, if you don't let them know what the symptoms are, how do they know if they've got it? How can they tell you if they've got a problem? So we go through all the tingling and numbness, pain in your hands, all that. But don't just read them off. Try and give people an understanding of what they're like. And a good one for us is like if you've ever been out in the snow on a cold winter's day and your hands go numb and you've got a loss of dexterity and stuff, and that's what it sort of feels like. But then the first thing you go back inside and do, well, when I was young anyway, I don't do it anymore, but you put your hands in front of the fireplace, warm them up, you get chilblains on your fingertips and they're burning and itching. And that's often what a lot of people get when the blood flow comes back into the hands. And that can be happening quite well often really throughout the day. So it's massively debilitating and uncomfortable. So it's try and go in depth is what I'm saying to the symptoms and how they feel rather than just reading them off. Keep going in depth into it, how they mean, what they feel like. You know, try and get someone to do a text with a pair of gloves on. It's just standard examples of how this can affect you and what the symptoms are like. So the next one we've got is what they can do to reduce symptoms, and it's the classic one: reduce smoking's in there, keeping the hands warm, good posture, all that sort of stuff. But go into it and be quite, I suppose, make it appropriate to what they're doing. So if they've got, I don't know, 5 people working and one person's just using the equipment, say to them, well, in that situation, could you not share the workload more evenly? So we try and make it really specific, and that is try and make it specific with this as well. Moving on to the next one. The very, very important bit is if you've got occupational health systems in place, you'll find that they're carried out every year. But what happens in between each assessment? Now, someone could have an assessment and then a few months down the line develop symptoms. Unfortunately, would they wait? And they probably would in a lot of cases. They'll think, I'll just wait till the next one and carry on doing my job. Got to encourage them that if they get symptoms, they come and find you immediately so you can take action on that. It's really important you get this across in the training as well. And that, as you can see, is the end. So it's quite easy to do a toolbox talk on hand-arm vibration. Obviously expand it in the sections. I've gone through quite quickly for the benefit of the video, but you really want to be about 20-25 minutes. I think the best toolbox talks on HAVs are. Make it personal and good luck. I'm sure you'll do a fantastic job. Cheers.